we have with us Dr. Anil Kumar Anand. Thank you for joining us, Dr. Anand. And you've just come out of a panel and you were discussing the emotional and practical challenges of neck cancer. So, what are your takeaways from that? What are the challenges, emotional and otherwise, you think there remain in that cancer?
So the question I was asked a lot was how we can make the head and neck cancer treatment more personalized, how we can reduce the disfigurement and the emotional trauma which the patient undergoes after he gets to know about the cancer and is very scared about what he will undergo as part of the treatment, how much would be the disfiguration, how much will be the problem in eating. So that's what I said, that we have made a tremendous progress in this aspect. So the first thing is earlier the better. If we detect cancer early, which should be our mantra, that go to the doctor early, get detected early, so that in stage 1, the treatment is also minimal and its side effects are also minimal and the cure rates are high. Cure rates are in the range of 80 to 90%. The moment we keep delaying tactics, we don't go, we think that it is not a cancer, we'll go after 2 months, 3 months, 6 months, then that cancer can, from stage 1, can go to stage 2, stage 3, stage 4. Now, in that stages, treatment becomes more intensive, it becomes more disfiguring, and then the problem arises.
Right. What can you tell us about the awareness aspect and how should one should be aware about head and neck cancers? Personally, I didn't know before today that there is a thing that that corresponds to such thing as head and neck cancer. So what can you tell us about those?
So one thing I also want to complete, that there is a technological improvement for the treatment. For example, for radiation, now we have technologies called IMRT, IGRT, which can cure the tumor with very little side effects. There are some temporary side effects, but in the long term you won't have. Similarly, surgical techniques have improved. So that is the part of the last question, that we have now evolved into much better way of treating a cancer, which leaves the person who can have social life, he can talk well, he doesn't have problem in speech, and he can swallow well. The second question you asked is, what should we do to detect? So I think the 2-3 things I would like to tell, and one of the most important is that many times you go to dental surgeon and you say you have a pain in the tongue or you have a pain in the jaw. So the dental surgeon will do some tests and will like to do some treatment, some scaling, and that ulcer doesn't heal. So I have seen many times there is even a delay while going to the primary care physician. There is a delay of 2-3 months. That should cut down to 2-3 weeks. So if the ulcer is not healing despite your dental treatment, you should consult a hospital where the more awareness is there. Similarly, a patient having cough and hoarseness of voice. आपको ये तो पता ही होगा, आवाज़ बैठ गई. So we say, oh, I got a sore throat and I have now a sore throat and a hoarseness of voice. So hoarseness तो कभी जुकाम खांसी में भी हो जाती है, it happens, but it should settle down in 2-3 weeks. But if this hoarseness doesn't settle down or hoarseness increases accompanied with cough, time to go to a specialist. Go to ENT surgeon or come to a cancer department. Now there is a cancer department in every hospital. There used to be a time when cancer department was there in only very few hospitals. Now you visit any hospital, you will find a cancer department. So it is, if the things are not going the right way, you just move into a cancer department where we will have a high index of suspicion and we can detect better.
Right, right. So when it comes to challenges, you've highlighted that we've made headway. Acknowledging that we've made headway all these years when it comes to cancer, what are the challenges that we are not being able to fight?
So the one, yeah. So I would say a lot of challenges are still early detection. Screening is very weak in India, very weak. There's hardly any screening. We have many screening camps, but nobody comes. Doctors go and sit there. Nobody comes for screening. So the first thing is that how to increase awareness, and I feel social media has a lot of things to do there, and doing some programs on TV, newspaper, and conference like this to increase the awareness that we must go for. Even if you have no symptom, you are just going for screening. And screening is a very simple thing. We'll do 2, 3 tests, we'll examine you and say, okay, you are okay, or you need something more. So this is we are lacking. We have failed in screening. We have also partially failed in early detection. I feel still we are seeing advanced cases. Early stage oral cancer, we see hardly 15-20%, 80% are advanced. Lung cancer, we see 80-90% advanced. So we have not made a very big headway in India in early detection. So therefore, when we see stage 3, 4 cases, naturally our survivals are poor compared to United States and North America and Europe. So when we compare survival rates of cancers, various cancers in Europe and America versus India, you will see in newspaper, it is about half. So why is this half? Half is because of late detection, stage 3, stage 4, and non-availability of expertise of surgeons, radiation oncology, medical oncology in tier 2, tier 3 cities where still the expertise is not available. So I think these are the reasons.
Speaking on the preventable aspect, one of the preventable aspect is vaccination. And we have a HPV vaccination which is coming out. Are there any prospects of such vaccines coming out for other cancers as well?
So first thing I must say, the HPV vaccine so far was recommended for women, cervical cancer. But now American cancer guidelines are recommending it for men also, penile cancer. You know, HPV is as much involved in cervix cancer as much it is involved in men in penile cancer. So in America, they will recommend even for penile cancer HPV vaccine. In India, it is not being recommended. So as far as other vaccines are concerned, unfortunately, we don't have, and I don't think we will have a vaccine in near future. So therefore, our main reliance is on screening, prevention, early detection.
Thank you so much, Dr. Anand, for speaking with us. Thank you so much.